Good morning, everybody. My name is Suzanne Gelderblom. I'm one of the psychologists that work at Stabilis Treatment Centre, Rehabilitation Centre for Alcohol, Drugs and Medication Abuse. Today I'd like to speak to you a little bit about binge drinking and give you some more information in order to make sure that you either luckily don't meet the requirements or that maybe you need to be concerned. So I'm going to start off with a scenario. Imagine this scenario. You're supposed to go out to dinner with friends. Last weekend you went out with the same friends and went overboard. So you decided to take it easy this time. You will just have a glass of wine with dinner and make it an early evening. But then at dinner, that glass of wine really feels good and you were really enjoying yourself and didn't want it to end. So when somebody suggests to take the party to the next venue, you agree, and before you know it, you are lying in bed, feeling that the world is spinning and it is 3 o'clock in the morning. Sounds familiar? Let's look at what is considered binge drinking. According to research, binge drinking is when you have 4 or more drinks within a span of 2 hours. That is for females, and 5 or more drinks within the same time span for men. Okay, what are some of the risks associated with binge drinking? So binge drinking has been linked to brain damage, reduced cognitive abilities, increased and worsening depression and anxiety, pregnancy complications such as miscarriage, stillbirth, and fetal alcohol syndrome, increased risk of violence or violation of the law, increased risk of cancer and other chronic diseases, nerve damage that leads to general weakness, incontinence, and even erectile dysfunction, and then lastly, alcohol poisoning. Binge drinking causes far more regrettable decisions and consequences. I would advise you to stop before it develops into a full-blown substance-induced disorder. So with that said, I think it's important to distinguish between what is a full-blown substance-induced disorder versus binge drinking. And if you do meet the requirements for only a binge drinker, does that mean that you need to quit? Does it mean that you need to look into possibly going for treatment and resolving or addressing some of the issues or the issues that is causing you to binge drink? Binge drinking, in my opinion, is emotionally charged. What I mean by that is that most of the time, when you go into a binge, it's either because you are not in a emotionally good space, so you may be going through a tough time, you may be experiencing very uncomfortable emotions due to your circumstances at that stage, or like the scenario that I explained earlier on, you may just have a very good positive effect from the use of the substance and you don't really want it to end. The fact of the matter is that what happens here is that your use of the substance is not only on occasion anymore. It is not to enjoy a glass of wine with dinner or a beer or while watching rugby. It is more so to try and change your current emotional state. So if your current emotional state is, for instance, stable, you not necessarily having a bad day, but you're also not necessarily having a good day, and after a whole week, by the end of the week, you go out with friends, and all of a sudden, after having that 1 glass or 2 glasses of wine, you do feel that, wow, but this feels good. I'm relaxed. I can socialize easily. I have the courage to speak to people where normally I would be more introverted. Then that could potentially become the trigger for you wanting to use the substance on a more regular basis. And that feeling becomes so good that you can't really control your intake anymore. And like I said, in the scenario, then you end up the next day feeling as though the world is spinning on a physical level, because your body is actually now intoxicated due to the amount of alcohol that you've consumed. But also your world may be spinning metaphorically, in the sense that you may not be able to recall what happened last night. You do realize that I'm not in the position to go to work because I'm still intoxicated. I still reek of alcohol. Um, so eventually it starts to impact your functioning, and that is where it becomes a problem. The other problem that we very often are confronted with and have to deal with in treatment is when we have, for instance, a patient that was admitted here for treatment, and the pattern of substance use, and specifically alcohol, is more so that of a binge drinker than necessarily a chronic drinker that needs to use alcohol every day. We often find that those patients would be able to rationalize their use of alcohol, and would be able to say, but you know what, yes, I do sometimes from time to time overindulge, but then I am able to quit straight afterwards, and I can go without the substance for a whole period of time. And if I was not able to do that, then yes, that would be indicative for me of a substance use disorder or a problem with alcohol. But the mere fact that I'm able to quit, that I'm able to maintain sobriety then for a long period of time, for me tells me that I'm still in control. And yes, that is the case, that during this phase where your pattern of drinking is more that of a binge drinker, there is still a certain amount of control. You are still able to go without the substance from time to time, and even for long periods of time. But the fact of the matter is, when you do lose control and when you do go into that binge episode, the damage that is done is sometimes severe, in the sense that it causes, interpersonally, it causes so much confusion for your family, because normally you are the type of person that they can rely on. Your behavior is predictable, you are always on time, you're responsible. And now if you go into a pattern of binge drinking every now and again, all of a sudden your behavior becomes unpredictable. Your family feels that they are not secure in knowing what is going to happen next. They are fearful of the consequences. They feel that you act irresponsible, and that then obviously causes interpersonal problems for you. And like I said, it may even at a later stage cause problems at work, because now, due to your binge episode, you're not able to go to work that day. So you may be absent at work more often. So in the long run, yes, your binge drinking may cause severe negative impact in your life. And because of the fact that alcohol dependency is progressive, your binge pattern can easily, if you continue doing it, it can easily run into a more chronic and habitual type of drinking pattern, where you need to use the substance on a more regular basis, and even eventually on a daily basis. So, is binge drinking dangerous? Is it a sign for you to maybe quit using alcohol? Is it a problem? I would answer yes to all of those questions, because it can eventually develop into a full-blown substance-induced disorder, like I mentioned previously. For any queries or any questions regarding the subject, please phone the center, or you're welcome to go onto our website and look for more information. Our website is www.stabilis.org.za. Thank you. Goodbye.